Well, aloha and good morning. It is Monday, March 8th here in Hawaii. I'm Ryan Kalexuju, joined by Yanji Denise, and this is Spotlight Hawaii. So great to see so many of you tuning in already this morning. We have a lot to get to with a very important and special guest, Yanji.
That's right. We're going right to the top. Live from the Capitol this morning, Governor David Ige is joining us. We appreciate your time, Governor. We have so much to get to. Thank you. Good morning. And let's start with some news that you have for us this morning.
Yes, thanks, Ryan and Yanji, again, for having me on. And I really do appreciate this opportunity to directly engage and communicate with the public. We are announcing this morning that we have identified a case of what's being referred to as the South African variant here in the islands. On one hand, it does demonstrate that our surveillance system is helping us identify these variants that are of concern. Of course, those who have been found infected with the new variant have been isolated, and we are tracing the contacts that they've had. Just an opportunity to remind everybody that even as we vaccinate people and more in our community is getting vaccinated, that we all know what public health actions helps to stop the spread of the virus. It is wearing our masks when out in public. It's about maintaining physical distance. And even as we get vaccinated, we want people to continue to take those actions to keep our community healthy and safe.
So if you can expand a little more on this variant specifically, what can you tell us about the person that was exposed, the surveillance process that led up to finding this out, because we do know that this was one of the variants that was known to be, that spreads quickly, that is a little bit more contagious and deadly in some cases. What do we don't know right now about its place here in Hawaii?
Yeah, certainly, Ryan. This is the first cases that we found of this variant. The state laboratory is working with all of the laboratories, private sector as well, to really identify those samples that they believe may be an indication that it's caused by a variant. We do take those samples, and we're sampling statewide about 75 samples a week that we run through comprehensive genomic sequencing, and that allows us to identify the specific variants. So this is the first instance of the South African variant that we found. We do believe that it's isolated, and we're working through contact tracing to find and interview those that may have been exposed. And again, we're just reminding people that the same actions work. Wearing our mask, maintaining physical distance does work, but this virus is more easily transmissible, and that's a concern. And there have been some studies that show that some of the vaccines may not be so effective against this variant. But we do know that the Johnson & Johnson vaccine is actually effective against this variant. So, once again, we're just encouraging people, when it's your turn to get vaccinated, even when you're vaccinated, continue to take the actions that we know work. Wear your mask, maintain distancing. Hawaii continues to have the lowest rates in the country, and it's because people are paying attention and making the personal sacrifices to keep our community safe.
And just to clarify, is it just one individual, one case at this time, or are there multiple cases found of the variant?
It's one individual and a close contact. So they're connected. The cases are connected at this time.
We also know other news that's come out this morning has been from the CDC providing new guidelines about those who have been vaccinated, saying that they can now gather without wearing masks, without physically distancing. But of course, when in public, they have to mask up once again. How do you think this new guidance from the CDC will impact state policy, potentially moving forward as you look to redo some of the restrictions that were initially put in place?
Yeah, just a clarification, Ryan. They are saying that if you have been vaccinated and you know that the people you're meeting with have been vaccinated, then it's okay to meet without masks. But they continue to emphasize that everyone should be wearing masks and maintaining physical distance. especially if you're not aware, if you're meeting with a small group and you're not aware of what the status is of whether they have or have not been vaccinated, it's a good idea to treat it as if no one has been vaccinated and wear your mask and maintain distancing. I think that's very important. So we're not planning any significant changes to our policies at this point in time. One of the things the CDC does say in their guidance is they're not changing how people should be treated in travel. They continue to recommend that people shouldn't be traveling. They know that travel does spread the virus, and especially with the increasing of cases of the variants, those that are traveling should be getting tested, and then they should isolate upon return.
On the subject of travel, Chase Deaton has a question that a lot of folks ask us every day on this program: is when can fully vaccinated travelers begin using vaccine passports? The concept of the vaccine passport, for those who are watching and don't know, is that if you have 2 doses of the vaccine after a certain amount of time, you could then travel freely, perhaps bypassing any testing or quarantine requirements. What's your view on that? Does the introduction of variants change that calculus? Do you think that this is going to happen anytime soon?
So just a couple things, Yunji. So clearly the CDC is saying that we shouldn't treat vaccinated individuals differently. So they shouldn't be traveling. Only those traveling should be traveling on essential business only. And they are recommending, even if you're vaccinated, that you should get tested. So the Safe Travels program continues unchanged at this point in time. I think one of the things we're working on a pilot right now with a cooperation of companies that are developing this, what we call a common path. So, they're actually a health platform, and they're helping to validate, people who have been tested, that they got the right test that we're requiring, they got it in the right framework, and they would validate and vouch for the quality of the test. So that what we do in Safe Travels, this Common Pass would do with a wide variety of testing labs and test facilities all across the country. I know I've gotten personal calls, for example, that someone got a test from the Mayo Clinic, and how can we question the quality of a test done by the Mayo Clinic? It's not that we question that, but we need to have a way to be able to validate whether a test has occurred or whether someone, in fact, has been vaccinated. And that's what this Common Pass group is doing. So we're currently in the middle of a pilot, Yunji. We are liking the preliminary results that we are getting. And Common Pass is committed to the vaccinations as well. So they are working to get and be able to validate vaccinations. And if they're successful, then we would have the opportunity to incorporate that into Safe Travels. But for right now, we're a while away from having that vaccination pass that is readily available to many across the country.
How long is a long way? I mean, can you give us an estimated timeline on that? How long is this trial program?
Well, I do think, Yunji, that until a lot of our community is vaccinated, so President Biden has said that that we anticipate that every American who wants to be vaccinated would have that opportunity the end of May. I would probably anticipate that that's about the timeline that we may be looking at changes, when a majority are vaccinated, and that we don't see the spread of the virus at the levels that we're seeing right now.
I want to bring in another question here from McGrew Rice, who's asking, when will we be able to travel inter-island without a test? We also know that this is something that has been brought to your attention. We've seen those case numbers go down, and in some cases, the island of Maui has more positive cases than the island of Oahu, and yet when you travel to Maui, you're required to test, but not the opposite way. What are your thoughts on any sort of changes that may happen to the inter-island testing that's required, and any modifications that may lift that moving forward?
Ryan, we are having that discussions. In fact, I met with all the mayors last Friday, and we talked about the inter-island quarantine. And we're working through that. As you said, the virus counts are coming down, except on Maui. In Maui, we do see it isolated to a couple of very specific clusters. We do have an outbreak in the Maui Community Correctional Facility, and it's just a challenge because that facility is overstuffed with prisoners, and it's very hard to isolate them, keep the ones who are infected away from those who are not. And that's been a huge challenge. We've started vaccination of all the personnel in that facility to try to slow down the spread. We are also seeing clusters in the general community. We'll be mobilizing additional testing capacity to Maui, and we definitely are expanding our vaccination programs. We are working to get the virus activity on Maui County to lower levels, and then we would be looking at changing the inter-island travel policies.
Do you think that will happen before that sort of end of May timeframe that you laid out for possible vaccine passport? Is it on the same timeframe, or do you think that could happen sooner?
It could be sooner, Yunji. I mean, you do see the drop in cases here on Oahu. We believe that we've at least identified the areas that we are seeing increased transmission on Maui, and we are focused on testing and making vaccines available in those areas. So, we're working with the public health officer in Maui and Mayor Victorino to really target testing and contact tracing and vaccinations if we believe it would help us reduce the number of cases.
And right now, could you give us an update on where we're at with the vaccine? We know that, of course, there was that delay that we saw because of the storms that happened on the mainland that caused the delay in shipments. And then last week, we saw a big ramp up, including some doses of that Johnson & Johnson that came to the state. What can you tell us about what you're expecting this week in terms of vaccinations and the number of people and the categories in which people will be allowed to get the vaccination?
As you know, Ryan, we are expanding the categories to 70 and older. And just talking with Dr. Char last week, she anticipates that if we continue to get the vaccine at the same levels, and the White House has committed for Moderna and Pfizer that they will only be increasing supply, they won't see a reduction in supply, that she anticipates in another 2 weeks or so, we would be looking at dropping that age break off even further than that. So, things are going well. We have an extensive network. Virtually every pharmacy, every community health center is receiving vaccines and helping us administer vaccines. So, we can definitely expand to take more vaccine as the federal government is providing it to us. And we still see very strong demand. People want to get vaccinated, and we are working to get them vaccinated as quickly as we can. Right now, Ryan, we because we can plan ahead, we do get shots in the arms within about a week of receiving the vaccine. There are isolated circumstances that might take us a little longer. But, I do see virtually within a week of receiving, people are scheduled and vaccinated. So that portion of the effort is really moving forward well.
We are seeing those case numbers go down. We're moving, obviously, Oahu has moved into tier 3. And if we continue on this trajectory, we could soon move into tier 4. What are your thoughts on that, on loosening restrictions and getting to tier 4, a lot sooner than it took us to get to tier 3?
I just think, Yanji, that we're all getting better at understanding how the virus might spread. And I think most importantly, taking the actions to limit personal interactions, wear our masks. I see it when I am shopping or out for a jog that more people are wearing the mask, and people kind of are conscious. They stay apart from each other. And I think all of those actions are really helping us to see the reduction in case counts. So I'm comfortable as we see lower case counts of moving into tier 4. You know, we've been working with Mayor Blangiardi and all the mayors to look at how we can relax restrictions in a safe and healthy way. You know, we are meeting with the sports groups, trying to get those started, sharing what we know to be the important health guidance and ensuring that they understand that and can help with enforcement in those activities. You know, we are working to get students back to in-person learning. I think all of those things are helping to get back to the new normal. And with more vaccines on the way and knowing that anyone who wants to get vaccinated would have the opportunity by the end of May, I really do see getting back to normal in early to midsummer.
You know, on that topic of students in classrooms, we've talked to Dr. Kishimoto last week, and she explained to us her, you know, goals of trying to get as many students back into the classroom. A lot of it is the logistical side of making sure that the infrastructure can handle some of the changes that would need to be made. What are your thoughts? Do you think that it's realistic that we could see in-person learning for our students, all levels, from elementary to high school at some point by the end of the calendar year? We know that the school year is coming to an end quickly. Do you think that's a realistic goal to see students back in the classroom by the end of the school year?
You know, I think, Brian, it's really important that we have to have a clear understanding of what the priority is. And the priority really is about keeping our students, our faculty and staff healthy and safe. So, you know, I want to discourage people just setting an arbitrary deadline and really rushing to get there. You know, we've created the Return to Learn program that talks about the things that need to happen in order for students to return in a safe and responsible way. You know, more than half the students already are back on campus, at least for a portion of their day. It's not, you know, school as normal as it existed pre-pandemic, but it does get them back. The department is focused on the high priority students, you know, those that are struggling, that have not been able to embrace online learning. You know, we are focused on them, and they are on campus and they're getting in-person learning. So I know that the superintendent and the system is committed to getting students back on campus and back to in-person learning. But I do think that what we're focused on is making sure that all those actions that can assure their health and safety is in place before all the students return to campus.
You know, on the subject of the superintendent, the HSTA has given her basically a vote of no confidence, saying that her contract should not be renewed. What's your take on the job that she's done, and do you have confidence that that her contract should be renewed?
You know, the superintendent has had to make very, very tough decisions that have been unpopular. You know, transitioning every single aspect in school is changed. You know, I'm a graduate, proud graduate of public school system, and everything that used to happen when I was a student and what happened just 2 years ago has been changed. How students enter the campus, lunch service, how they are in the classroom, every single aspect has changed. And yes, some people don't like the decisions that she has had to make. You know, we've had this budget crisis, which threatened to lay off a lot of people. And that's not her doing. That's a result of the coronavirus pandemic. You know, I do support the superintendent. I think that she has made the tough decisions. You know, we're further along than most other school districts across the country. She advocated for us to reduce the budget cuts, and we did. The public schools were first priority in a reduction in the cuts. She advocated that school personnel should be tested as a priority, and we've tested more employees at our public schools than virtually any other state in the country. So I do think that we're well positioned. And I think that superintendent can do a good job moving forward.
I want to bring in another question here, asking about vaccines. Alan's saying, when can we expect everyone will be eligible for the vaccination, summer or fall 2022? You had said just moments ago that the White House had made note that you won't see any reduction. If anything, you'll get more. Knowing that, when do you think it'll be realistic for the general public to be able to start getting vaccines? And how are you going to manage that? Because right now, right, we have these classifications of ages. Once you sort of open it up to those broader categories, we could see a lot of people in lines or trying to get appointments. How are you going to manage this as we move towards some of these larger numbers?
You know, Ryan, that's why we've been really focused on trying to get as many institutions involved with vaccinations as we can. You know, we have more than 100 vaccination sites right now as we speak. Every pharmacy, every community health center, every hospital, the large clinics are all involved with vaccinations. And that's because as we get more vaccines, it's really easy to double when we have 100 people who are certified in being able to receive vaccinations, give appointments, and give shots. You know, I am very comfortable knowing that we could double the number of doses virtually in a week's time, because we have so many people who are involved with the vaccinations. So, you know, as the president said that he anticipates getting enough vaccines so anyone who wants to be vaccinated will have that opportunity by the end of May. So I do think that shortly after that, we should be able to offer it to anyone who wants to get vaccinated. And we should be able to get them vaccinated in an orderly manner.
One of the things that we've covered extensively on this program is the unemployment issue, specifically delays in benefits to people who have been waiting quite a long time. We know that a lot of those issues are getting resolved, and on a broader scale, there's a contract now to replace the mainframe that'll take about 18 months. But one of the things that people continue to ask us to ask is, when do you think that in-person appointments can resume? The director was on here. She said she simply doesn't think it's safe for her staff. What's your view? When do you think that that could actually happen? Is that something that you're advocating?
I have been working with Anne. You know, she is concerned. I'm getting as many of those requests about people who are frustrated and believe that they're entitled and haven't been able to make contact. So we have been working for some way to safely allow for face-to-face contact. You know, we're looking at, you know, using the technology and maybe being able to schedule video appointments for those who need to work through some issue with their unemployment so that they can be certified and if they're qualified, get access to the benefits. So we're trying to work that in as quickly as possible, Yunji. So it wouldn't be an in-person, but we do know there needs to be some way for individuals to talk one-on-one with people in the UI office so that we can verify, validate, and correct, if necessary, their claims. And we're working to get that done as soon as possible. You know, I think what has been a huge challenge is that every time we establish a phone call-in line, we're just inundated with hundreds of thousands of calls. You know, there are all kinds of technology mechanisms that just flood the unemployment office. And, you know, we are using technology to try and separate those that are coming from other computers. You know, we're doing a better job of screening those out. But that has made this just a huge challenge to differentiate and to allow the person-to-person contact that would really help resolve a lot of these claims.
You know, we're looking at what's happening across the country with other states lifting restrictions. Of course, Texas making headlines last week saying that they would remove all restrictions and not require mask mandates. How do you think those decisions by other governors in other states could ultimately impact us here in Hawaii as people begin to vacation here? You know, this past week in Waikiki, again, we're getting to see more and more people coming here and vacationing and feeling comfortable traveling to the islands. How do you think some of these decisions being made by other governors and states could impact us here in Hawaii, and what steps are being taken to ensure the safety of these visitors and our residents here?
Yeah, you know, Ryan, thanks for that question, because it is something that I think we have to be aware, we are a global society now, and people travel. And what happens in Texas and Mississippi does impact us here in the islands. It's unfortunate that they decided to drop their mask mandates. Everyone is saying that people need to continue to wear their mask in order for us to reduce the number of COVID cases. And cases are actually increasing in the state of Texas. So it doesn't make sense, and it does impact us here, because as long as the virus activity is high, I know when I checked this morning, we had more than 60,000 new cases yesterday, which is much, much too high in order to really reduce the spread of COVID. It does impact us here. We have a terrific partnership with the airlines, Ryan. We've asked them, and they have been stressing with those traveling to the islands that we do have a mask mandate. We're asking all of them to comply with that mandate. We've been working with the hotels to reinforce that message. In my last few emergency proclamations, I've actually included, at the request of the businesses, that we say that businesses cannot take customers who do not wear masks. And they asked me to put that in the order specifically to help them with enforcement, so that they can say it's not the business that's asking them to wear their masks, it's the governor and our laws and regulations that require mask wearing when people are out in the public. So, we've seen a good compliance, Ryan. It is a concern as other states are reducing their restrictions, but we continue to work with our travel partners to re-emphasize the message that, yes, we want travelers who can get a pre-travel test, who are negative on COVID-19. We want them to be able to come here and vacation without quarantine, but we also are asking that they be responsible, that they respect our restrictions, they wear masks, and we've, tried to work with the properties to enforce those who continue to disregard the requirements here in the islands.
This week, we're marking a number of sort of grim milestones or anniversaries, if you will. A few days ago, it was the first case that was found here in the islands. A year ago, a lot of people saying that this is sort of a year ago, we were experiencing the last normal weekend of our lives before everything changed. I wonder if you would reflect for a moment on when was, I see this sort of hashtag on social media. People are calling it the moment they realized that life was not going to be the same. What was that moment for you? And in the last year, I just wonder if you would reflect on the year that we've had.
Yanji, for me, when I issued the stay-at-home order and the 14-day mandatory quarantine, I knew that it would change Hawaii, and that there would be many impacted, and it would be a long time before we got back to the new normal. I knew that many would become unemployed and that our economy would suffer. And that's really been the biggest challenge about taking actions that we know will result in businesses hurting, people becoming unemployed. Trying to get everyone back to work in a safe way continues to be a big challenge that I think we all need to embrace. The past year has been a huge challenge. There's been no time off. It's just a relentless endeavor to think about COVID-19 and the pandemic 24 hours a day, 7 days a week, has been all-consuming. And thinking about how we can safely get visitors here. We do know that the visitor industry is the largest industry and employs many in our community. And until we can safely bring back travelers, we will continue to suffer and struggle because so many in our community rely on visitors in order for them to have a job and continue working. I think that's been the biggest challenge. But I do see the light at the end of the tunnel. Vaccinations are promising. It's remarkable how quickly a safe and effective vaccine was developed. It is reassuring to know that our scientists believe, even with the variants, that the vaccines can be modified to respond to variants as it becomes necessary. So, I'm hopeful. I'm glad that many in the islands want to get vaccinated. I do believe we have a good plan, and we are executing well on making that opportunity available when it's people's turns. And I do appreciate all of the personal sacrifices that people have made in order for Hawaii to be the lowest infection rate and the lowest mortality rate in the country.
All right, Governor Ige, thank you so much for starting the week off with us and providing us the updates on some of the things that have just evolved today. We really appreciate you always taking the time to take our questions as well as the questions of our viewers and readers of the Honolulu Star-Advertiser. Thanks so much.
Aloha.
Thanks.
Aloha. Thank you. Well, we covered a lot of ground there. I saw some questions sort of just recently, people asking about the variants that were found, or the variant that was just found. The governor did discuss that at the top of the broadcast. So when we're finished, you can go back and watch that. But basically, it sounds like 2 cases of the South African variant detected here in the islands, 1 case, a contact of the other. So they know at least where one of those came from. But they're still doing a lot of contact tracing to figure out the South African variant is one that is supposed to be more contagious and is something that we definitely need to be watching and being careful for.
We also know that the CDC came out with new guidelines about those who have been vaccinated gathering with others that have been vaccinated as well. The governor weighing in on that ruling, saying that he understands that the progress has been made, but also recognizing that there are still a lot of threat out there with these variants involved. And so we don't expect to see any real changes to the travel plans and the Safe Travels program with a vaccination passport as they continue to work through that. You also heard him talking about this Clear Pass program that they're in the process of working on through a pilot project that would essentially help to incorporate the things that have happened with the Safe Travels program and the testing, as well as vaccination efforts moving forward. So we'll look for more updates from the governor's office from that as well.
Yeah, he described basically it's a pilot program in the works, but it would be an electronic verification that you did receive your vaccine, because right now, of course, people who get vaccinated just get a paper card, which is fairly easy to forge if you needed to. So this is a way to try to figure out how to make sure that it is a verified vaccine. So they're working on that, but don't expect any changes, the governor says, until probably the end of May. One thing he did say, we could see some changes to the inter-island restrictions before then, so that him giving a time frame for that. And then interesting just to hear his reflections and knowing that when he did put that lockdown in place, a lot of things would change for so many here in the islands.
Yeah, and really the governor's saying that it has been just a 24/7, 7 days a week effort with COVID and his administration, of course, as well as everyone else that has gone and lived through this for the past year. Hard to believe that we've actually been doing this as well for the past year. We actually started off 7 days a week. I'm glad we moved to 3 days a week. A lot less work on our end. But it really has been quite a year, and we thank the governor for always making time to join this program and to be a part of it. He was actually one of our first guests on this program and continues to come by and give us updates to provide to all of you to see what the state is doing to combat this, obviously, this pandemic.
Yeah, and interesting, a lot of people here in the comments asking, when is it my turn? I have this special situation. Why haven't I been vaccinated yet? The governor basically saying that the Department of Health is doing it in age increments. And he did say that he expects in about 2 weeks that they could open up to another tier. Presumably that would be those over the age of 65. And sort of on a broad basis, kind of following the White House's timeline, saying that by sometime in May, anyone who wants a vaccine can get one. So we'll be watching those numbers. Good news there that they don't expect any doses to go down. If anything, we're just going to be getting more doses of the vaccine and hopefully getting more of our community immunized as soon as possible.
Yeah, the governor confident that they can handle the influx of people that may want them, as those categories tend to get a little bit broader as we move down the scale to the general population. So we'll continue to keep an update on that and let you know any information that may be coming out about vaccinations and efforts happening by the state and the Department of Health to get those shots in arms to those in the general public. And we thank again the governor for his time. We continue to look forward to more conversations that are happening this week and beyond. We thank you all for taking time to join us here this morning. We'll see you right back here on Wednesday at 10:30. Aloha.
Aloha.